Greetings, everyone, and thanks for joining us today. Feel free to continue to put your name and affiliation in the chat. We love to see who's here with us today. I'm Yasmin Graywall-Koch, Policy Fellow at Chapin Hall, and we're excited to partner today with our friends at the American Public Human Services Association to talk about our collaboration around economic and concrete supports as a child welfare prevention strategy. We'll be sharing the results of our National Survey of Child Welfare Leaders and about an upcoming series of mini briefs related to the findings. We'll also be engaging in conversation with our panelists, who I'm going to introduce now. From APHSA, we're joined by Capriya Lee, Project Associate in Child and Family Wellbeing, Matt Lyons, Senior Director of Policy and Practice, and Meg Digert, Senior Policy Associate in Child and Family Wellbeing. We'll also be joined by my colleague at Chapin Hall, Leanne Heaton, Research Fellow. And we're excited to engage in dialogue today with Suzanne Miles-Gustave, Acting Commissioner of the New York State Office of Children and Families. A few housekeeping items before we begin. You will receive our presentation slides after the webinar, as well as a recording. We'd love to hear your insights as this webinar progresses and any questions that come up for you. So please use the Q&A function in Zoom for your questions, and we'll either answer them in real time or we'll answer them at the end of the webinar during our Q&A time. Now we'd like to get a sense of who's in the audience, so let's take a quick poll. So what background are you bringing to this webinar today? Please choose one that most closely connects to your current role or work. We'll just wait for a little bit longer to make sure everyone has time to fill out the poll. All right, it looks like we have our results. We have a nice diverse group in the audience today. 44% are from the child welfare sector. We also have several from research and academia. Excited to see some community-based organizations and direct service providers. All right, with that, I'm going to turn it over to Matt Lyons.
Thank you, Yasmin, and hello, everyone. Good afternoon, good morning, depending on where you are in the world. It is great to be here. We are so thrilled to be able to share some of the insights out of our partnership and collaboration with Chapin Hall, which we've been on a beautiful journey over the past several years with some amazing support from our philanthropic funders with the Kellogg Foundation and the Doris Duke Foundation. To really set out on a really strong shared vision of kind of bringing research and practice together to change the way that we are kind of wiring our public systems to ensure that when families who are experiencing poverty and have material needs, that our response systems are meeting them where they are in lieu of pulling folks into the child welfare system. And so we've had the privilege to be able to collaborate with our members as well as with other national partners in coordination with Chapin Hall, really around kind of three complementary strategies that we are looking to advance. Today, you're going to get a chance to hear some of the early insights from some of our national reports that we've been developing. And really the first really kind of landmark one that looks at the perspectives of child welfare agency leaders and some of the mental model shifts, as well as some of the detailed strategies that public agency leaders in child welfare systems are advancing around the uses of economic and concrete supports to prevent child welfare involvement. I am really excited that we're going beyond that and building out that evidence building strategy to look at those kind of parallel perspectives and strategies from our economic assistance leaders, as well as our community members, people with lived experience on how they perceive this relationship between poverty and child welfare involvement. We've also really prioritized creating the peer-to-peer space that it takes for public leaders in state and county systems to shamelessly steal from each other ideas and solutions and how to align moving systems upstream to prevent child welfare involvement and support families with their basic needs. And where we're driving towards, and we'll talk a little bit more about this towards the end of the conversation, is really taking all those insights that we're gleaning together in collaboration with Chapin Hall and moving towards engagement with federal policymakers within the administration, as well as on the Hill, to really help drive national policy change that can scale and accelerate many of the amazing practices that folks in this room are actively pursuing in their respective roles within state, local, community organizations. And so we're thrilled to be a part of this. I'm going to turn it over to my colleague Leanne at Chapin Hall, who's really going to get into the meat and potatoes of some of the work and some of the early insights of our collaboration.
Yeah, thanks, Matt, and good afternoon or good morning, and so glad to have all of you join us today. I'm excited to be able to share some findings from our first national survey of child welfare administrators. So I'm going to start with giving you an overview of the survey. And before we get going, what I'd like to do is define what we mean by economic and concrete supports. So in this first set of examples, you can kind of think about these as the cash or the money, the ways in which we can give money directly to families. The second area, we kind of think about this as what we might have through our human service systems as well as our public benefits programs. So some of the things that families need: childcare, housing, SNAP, WIC, Medicaid, and so forth. And then this final block are some of the things that we routinely find that families need when they come to child welfare attention. Sometimes it may be rental assistance, utility assistance, food, clothing, and so forth. So it's important for us to have a common understanding of when we're using this term today, this is what we mean. We also use this term throughout the survey to ground our respondents so that we all had a common understanding. So we organized the survey to answer 5 key research questions. The first question: what are child welfare administrators' beliefs about economic need and child welfare system involvement? Our second question: we wanted to understand approaches. The approaches state child welfare agencies use to offer economic and concrete supports to families. Our third question related to how state child welfare agencies coordinate, and specifically how they coordinate with other human service systems. Our fourth research question were centered around barriers to offering these supports, but we also were interested in understanding solutions. And then finally, we had a fifth question because we wanted to understand how state child welfare agencies used emergency federal assistance to fund economic and concrete supports. So the next slide that I'm going to show you is our completion rate and our completion rate by state. We fielded the survey back last fall and into the beginning part of 2023. And what we see here is a pretty good completion rate by industry standards. We had a lot of states, over 60% of states complete all the questions. And then we had a handful of other states that completed most questions all the way to that COVID battery that answers the fifth question. So if we combine those together, we get us to a 75% completion rate. And so the findings that you're going to see next represent those states. And so we'll start with answering that first research question. And the first question really centers around beliefs. beliefs that child welfare administrators have about economic need and child welfare system involvement. And so you may be asking yourself, well, why do we care what administrators believe? It's very important because beliefs drive agendas and beliefs drive strategic priorities. So we really wanted to understand what these administrators believe, specifically about what the child welfare agency should do during a CPS investigation. So for example, we asked questions about screening for economic need. That's that first block. Referring families to economic and concrete supports, the second block. And then the third is helping families receive them. So you can see the number of states there to the left on that vertical axis that selected these categories. And then the response options are there at the bottom on the horizontal. And this is the same kind of convention that we'll be using to share the findings throughout the next few minutes. But what's important takeaway from this slide is that our administrators were more likely to agree that the child welfare agency should screen and refer families to economic and concrete supports during a child protective services investigation. So the next slide are the very same questions, but this time we posed it about the public benefit system. And you can see here that our administrators were more likely to agree that the public benefit system should help families receive during that CPS investigation. So the next set of questions that we asked, we wanted to know what these administrators thought about suspected maltreatment reports and how often they felt economic needs were a part of that suspected report, or whether the inability to meet the needs was a primary reason or a contributing reason, and so forth. And what you can see here from our findings is that our administrators agree that economic need is frequently a contributing reason of suspected maltreatment. The next set of items we wanted to know is, okay, who is the right entity to help families access economic and concrete supports to prevent child welfare involvement? Is it the public benefit system or the child welfare agency? And our respondents agreed that both really should help families, but they had a stronger preference, a much stronger preference for the public benefit system to help families access them. And then finally, as we round out our questions related to beliefs, we asked about a number of different kinds of needs, and you can see the 6 here. The top 3 that our administrators mentioned in being frequently a part of suspected maltreatment reports are childcare, money, and housing. This next few findings will answer our research question 2 about approaches. We asked, are their needs assessed during the hotline screening process? And what you see here to the left is that answer. On the right, we then asked, what about during a CPS investigation? Are the needs assessed? And what you can see, the responses are almost mirror opposites. Most respondents report that economic needs are not assessed during the hotline screening process, but they are assessed during a CPS investigation. The next set of questions we asked were about funding. What kind of funding do you use to actually offer economic and concrete supports, both to pay for case management survey or case management support, and that's shown in the bars on the left, but also how do you pay for economic and concrete supports directly? The top 4 funds are, you can see here, the state funds were actually the most common for both case management and direct service, followed by federal funds, Title IV-B, Title IV-E, and transferred TANF funds. We then asked about how child welfare agencies and how they coordinate with other human service systems. The majority of our administrators said that they regularly coordinate with other systems. But what is interesting to note here is they also selected that most of the programs that are really important to offering specific kinds of economic concrete supports, like housing, like TANF, SNAP, childcare, so forth, these are actually administered by a different division, one that is external to their child welfare agency, and that's shown in the green bars. And so one of the key points to make about that is that these are different leaders with perhaps different priorities and vision than the child welfare strategic priorities. Our next set of items answer our research question 3, and we were interested in understanding barriers and solutions. So we asked several different kinds of barriers, starting with coordination barriers. Our administrators noted that staffing resources were the most problematic coordination barrier, more so than funding for coordinated technology, legal barriers, or even funding for services. The next set of items asked about levels and restrictions on use of both federal and state funds. And our administrators noted that specifically that the levels and restrictions on federal funds were more of a significant barrier than their state process. And then finally, our last set of barriers were around public policy. And our respondents overwhelmingly identified that the public benefit eligibility restriction was a most significant policy barrier, even more so than federal and state mandatory reporting requirements, state neglect statutes, and even political resistance. And then finally, we wanted to know, well, what do you think is the solution? So we asked a lot of different items around solutions, but these were the top 3. Overwhelmingly, all of our respondents said direct funding to expand access to economic and concrete support would be the most helpful. At the very end of our survey, we asked one open-ended question. We were very interested to know from these leaders and their experience, what do you think needs to be done? And we were really surprised that so many of these leaders actually took a lot of time to write pretty detailed responses about what they thought would work. And you're welcome to kind of look through our full survey report. You can see some of those quotes. But when we analyzed these quotes and the different information, we really came to 4 themes that they represented. 1, more upstream shared responsibility, direct and flexible funding, policy changes, and then awareness and access. So then that got us to some of our final recommendations. So we looked at the results of our survey as well as these open-ended suggestions, and we came to 5. The first is this establishment of a joint human services leadership commitment to shared responsibility. The next, increasing direct and flexible federal funds to meet family economic and concrete support needs. The third, to revise policy and practices that contribute to unnecessary child welfare system involvement. And suggestions that some of our leaders had were to consider mandatory reporting practices as well as definitions of what constitutes maltreatment, specifically around neglect. Our 4th recommendation is to promote increased understanding of the relationship and the evidence, the well-established evidence between economic and concrete supports and reduced child welfare involvement. And even more so than just sharing this information with agencies or with community partners, but really almost like a public health campaign to educate the wider community, policymakers at both local, state, and federal level. And then finally, to do much of what we are doing here today, engaging in a national learning, as well as innovative demonstration projects that are focused on effective ways to redesign human service systems. And so with that, I'd like to close out by asking folks here today to engage in a poll. We're very interested to know what you think. So if we could just take a few minutes to put up our poll. So what we want to know is your perspective. If you had to pick the main challenge, so there may be several different challenges that you have encountered in providing economic concrete supports to families, but we'd actually like to know, out of these options, what do you think is the main challenge? And we'll give folks just a minute to complete that poll. And I think we can get ready to close our poll out. Wonderful. Thank you all for completing the poll, and I am going to turn it over now to my colleague Priya Lee at APHSA for our next segment.
Thanks, Leanne. So as Leanne presented about, we have this larger survey report that really outlines a lot of the detailed findings and analysis that was done around the child welfare survey. But what we also wanted to do was to break down those findings as well as some recommendations into smaller mini brief series that really focuses on, bits and pieces of the findings and recommendations. And so specifically, we've broken down the briefs into 4 parts, each of which really focuses on the first 4 research questions within the survey. And so looking at beliefs of child welfare leaders, their approaches to delivering economic and concrete supports, their coordination with other agencies, and then finally those barriers and solutions to delivering economic and concrete supports. And so we're looking to release the first of the series in about a week or so, and we're really excited to really share the insights and again those kind of high level findings from within the survey with you all within that series. And so be on the lookout for those mini briefs. And so with that, I will turn it over to my colleague, Meg.
Thank you, Kafria. Seeing a lot of great questions come in and comments in the chat. Keep those coming. Really excited now to bring Suzanne into the conversation. And as Suzanne, as someone who's been part of this work originally with the Advancing a Family Economic Mobility Initiative, and now through the community practice and our convening coming up in April, which we'll hear more about from Matt later. But I want to gather some of your perspectives here. What key findings from the survey really stood out to you?
So thank you. Make sure I'm off mute. Yes. Thanks again. Thanks to APHSA and Chapin Hall, 2 of my favorite partners. Thanks for inviting me to participate in this. Yeah, so as you said, Meg, we've been doing this work for a minute, but I think in that survey, one of the most significant pieces of data for me was really that a large majority, I think it's at 83% of respondents said that their agency does not track families' economic needs, even though they acknowledge economic needs. It's frequently a contributor to that suspected maltreatment report. Now, to be clear, New York is in that 83%, right? We do not track that at the outset, but this is super telling to me, and it really provides, I think, all of us an opportunity to examine how we work with families and the current gaps in meeting their needs. So, for example, New York State, with respect to our systems, our initial child abuse hotline, our state central register, several specific allegations are combined into the federal NCAN's categories of neglect or deprivation of necessity. And that includes educational neglect, inadequate food, clothing and shelter, and inadequate guardianship. And as you can imagine, many of those allegations may be directly linked to poverty or economic insecurity concerns. And much like the national data out there, I know Chapin Hall has a great deck that demonstrates this. In New York State, approximately 65 to 66% of all accepted reports involving only that neglect or deprivation category go down to then the local district, and once investigated, about roughly 13% of those reports are substantiated. So this is why in New York State, right, much like our other sister states, we are truly focusing on like transforming our systems from a child welfare system into a child and family well-being system. That is the hope, right, with a focus on providing families that upstream preventive services, right, really narrowing the front door to that child welfare system. But back to your point, overall, I think the findings really suggest that economic supports may be more of an indirect, kind of uncoordinated effort within many child welfare systems, rather than a core focus of, right, dedicated tracking and really strategic alignment of resources. So again, it doesn't surprise me, but really I think motivates me to share with my New York State partners and reiterate here to senior staff that this really should be our focus. And really, I think these findings provide each of us with an unprecedented opportunity to reimagine like how we work not only with children, families, and communities, but with our partners, agencies, and nonprofits.
Yeah, thank you. And it's bringing me back and recalling something that we heard in the comments in the survey from leaders frequently was that siloed system that, you're working in your tunnel and you don't know what the other tunnel is doing. And there's some windows into that tunnel,
Right.
but at the end of the day, they have their own procedures, their own data collection, their own eligibility.
Roles. Yep.
Absolutely. And I hear this reflected often through NAPWA, which is the National Association of Public Child Welfare Administrators, and moving upstream, but really that siloed feature in child welfare is the only one right now that can't say no. So
Right. Exactly.
yeah, really appreciate you sharing a little bit about New York there and your perspectives on some of the findings. I want us to imagine the future now. So if you could look 10 years from now and say that the final recommendations in the survey and those themes that Leanne really brought up, say those were really applied by our lawmakers and our leaders, what would be different 10 years from now if those recommendations were applied?
You're asking me to dream a dream there, Meg. Dream a dream, my world. I think honestly, in an ideal world, we would see just what you said. We would see those governmental silos dissolved, which would really bring about really improved collaboration and a shared vision amongst our state agency partners when it comes to family support. Right, one where agencies that administered public benefits also see themselves as working toward keeping families and children safely together and safely at home, and also strengthening that family unit, both from the leader perspective to the front line, right, recognizing that public benefits and other economic and concrete supports are helpful, right? So, but in New York, I will say that our human services partners are right alongside us, working to support and strengthening our families. We're trying in New York, our Office of Temporary Disability and Assistance and our other state partners, we're trying to really create this integrated service delivery system, but there are barriers, like true realistic barriers to cross systems work. But we are trying. Maybe in 10 years we'll be there. But hopefully, to your question, 10 years from now, we would have successfully shifted that narrative around economic and concrete supports, right? Moving away from blaming an individual or a family for their circumstances towards addressing and changing the inequity that exists not only in our system, but society at large. My hope.
Yeah, I'm dreaming that dream with you. Yes. Absolutely. And I think there's so much momentum in having this conversation. And Matt said earlier, the survey really being kind of a foundation, a landmark, and we're looking forward to exploring more and going deeper and collecting more data to then inform some more recommendations and creating that movement.
Right. I was going to say also my other dream is that in future, 10 years from now, we would not have the barriers of data sharing, right? We now, it's impossible almost, but we're working on it, right, to share data amongst our sister state agencies, even knowing that we're in the same state, working with the same families. So I think my dream would also be we would not only dissolve those governmental silos, but relax those rules that are right there for a reason, privacy protection and all that, but they are not benefiting our families because we can't work together in meaningful ways.
Yeah, absolutely. And every state system is also different too. So having one state then
Yeah.
share to just in between agencies for the data. So yeah, that's a huge opportunity. And I know one that also impacts the workforce and the work that they're doing.
Right.
So how can technology really be supportive to the workforce in the future? And what does that look like for case management and for families that we serve?
Yep.
Well, I have one more question for you before I'm going to open it up to some of our other panelists.
Sure.
But the survey showed that child welfare leaders believe that there should be collaborative efforts to resource families before they become involved with the child welfare agency, which we've talked about a little bit, and the work being done with other health and human services agencies. Can you share what steps child welfare agencies can take to strengthen collaboration to partner and increase those resources for families?
Yeah.
Prevent child welfare involvement with those other health and human services programs.
Yes, right. Of course, we need to collaborate and strengthen our partnerships with our other state agencies. But that came through loud and clear in the survey. And we have to be truly innovative, right, in how we do that. But we also have to tap into the strength and resiliency and expertise of our families and communities. And there's so many grassroots organizations and nonprofits who are the experts in providing services and supports, but oftentimes we don't engage with them directly. Sometimes we don't know who they are at the local level. But probably most often is that we don't fund them enough. We don't invest in them enough to help those families. So the question is, how are we engaging with these local nonprofits and supporting them so that they can in turn support our families? But one of the ways New York State has engaged in a cross systems collaboration was through one of our programs, through our family opportunity centers. These are designed to really improve the safety and well-being of children and families by addressing issues of poverty or educational barriers, substance use disorders, a lack of adequate physical and mental health in the community. So these family opportunity centers came about as a collaboration between OCFS and the New York State Department of Education, and funded through a mixture of state and federal dollars. So it was an incredible example of braiding and blending funding in a very creative way. And those allocations were to community-based and school-based programs that provide child and family center programming, very culturally responsive way. But developing this model required many meetings, many revisions to our RFP. There were times, quite honestly, that we did not think it was going to happen, but we had a shared vision and a commitment to really make this a reality in talking about the need for community pathways to prevent child welfare involvement. So it may sound simple, but that really is the key. It's recognizing the need for change and having a shared vision for and with the children and families you serve. But also requires trust building, so that open and candid communication with your state agency partners can take place. You really have to assess and reassess the need to work and to have others as part of that collaboration, right? To make sure that we're listening to children and families, right? Are there folks at the table helping to make the decisions, the folks that should be at the table helping to make those decisions? And we need to, as a state, really particularly amongst our child and family services agencies, really improve that, as mentioned before, that data collection piece. So sharing to make it more likely that we can get those funds from either our federal partners or potentially even philanthropic partners, but we need to share that data and create the evidence base for that support.
Awesome. Thank you so much. And I really appreciated what you shared about trust building, both from the agency perspectives and working together, but also building the trust with the community and partnering with places that hold trust with the community and school-based and community-based organizations. And I really appreciate that, part of the work. Well, thank you. Well, I want to invite our other panelists to join us now, and we'll hear a little bit more from Suzanne later, but I'm going to invite Matt, Leanne, Yasmin, and Capriya back into the conversation. And I've got some really tough questions for you guys, so I hope you're ready. But I'm going to start with Leanne. And Leanne, I remember you, me, Matt, and Colin on meetings back in 2022, developing these questions. And we went from research questions to a whole survey. So I'm really interested in your perspective on what from the survey findings really resonated and stood out with you.
Yeah, thanks for that question, Meg. There are two things, and I think one of these is similar to what Suzanne mentioned. I was really struck by the stark opposite directions that we saw in how child welfare agencies do screen for economic and concrete supports during a CPS investigation, but not at the hotline. One of the reasons why I think that finding is so wonderful, it shows such a great opportunity where prevention efforts could be placed in a child welfare agency. The other thing that really stood out to me is when we think about families becoming unnecessarily involved and just the desire many of these leaders reflected in their open responses to have that coordination with their public benefit partners, specifically because they realize that they can't do this by themselves. And to get us to a place where that whole system, public benefits and human services, would see themselves as prevention in the same way as child welfare desires, I think is also a really important finding. So appreciate those questions.
Yeah, thanks, Leanne. And I'm excited for some future work that we have planned and really building on this survey and the results to support momentum here. I am going to go to Yasmin. Yasmin, it's been great working with you on this project, and I know you've also been a part of the Advancing Family and Economic Mobility Initiative from the beginning in 2021. So I wanted to ask you, how can we take action on these survey findings?
I think one actionable strategy is for jurisdictions to use our co-branded evidence to impact economic and concrete supports policy tool. We released that last year, I believe, and we'll share a link to it in the chat. It's a really great tool that jurisdictions can use to bring together child welfare and partner agencies to collaboratively review their current state or local policies and see what options they can implement to expand access to economic and concrete supports for families across a variety of different mechanisms, from tax credits to direct cash transfers to TANF, child care, and SNAP, all aligned with the research related to reducing risk for child welfare involvement.
Thank you, Yasmin. And that tool was created through work that was done with I believe 5 state jurisdictions, if I'm recalling the original group right. But with APHSA and Chapin Hall, it might have been 4. I added 1. I got excited. So we're really excited for that tool, and it was really a labor of love to be comprehensive. And so we hope that's really useful, and please use that and let us know how you're doing with the tool. I'm going to go back to Suzanne now. And I'm wondering if you can share what strategies New York is deploying to expand access to economic and concrete supports as a primary prevention strategy for child welfare. I know you touched on this a little bit before, but wanted to see any other strategies you wanted to share.
Yeah, so primarily we're doing 2 really exciting things. But before I even get there, ideally, of course, we'd love to see more federal funding allocated to economic and concrete supports, including funds for direct cash transfers we know are needed in so many communities. Because the one good thing that came out of the pandemic, not many, but one, was this shift in thinking about providing families and individuals with guaranteed income. So New York does have a direct cash transfer pilot in 3 of our counties in New York State. It's Westchester, Onondaga, and Monroe. And so through this pilot program, we enrolled 150 families across 3 counties who are child welfare involved, and they are receiving $500 per month via a debit card unconditionally for 1 year. So total $6,000 per family. And financing for the pilot is a mixture of separate federal, state, and private funds. So it is the first in the nation devoted to families with child welfare involvement, and we're partnering with the University of Pennsylvania as a research partner to study the pilot, with the hopes really that we can help build a body of evidence that supports economic and concrete effort. So hopefully we'll be able to submit something to the feds to, again, advocate for more flexible funding. We don't have specific data right now, but recipients of the New York families that have received finances have completed a 6-month survey. And we're hearing things like where they're happy to receive the funds, they have less stress, and are able to pay their bills and obtain what they need each month without the usual worry and concern or requirements that come with some cash assistance. So that's one. Second, as you mentioned, right, New York State was a member of the APHSA Chapin Hall supported and Doris Duke Foundation funded Advancing Family Economic Mobility Learning Collaborative, with the goal of developing strategies to reduce child welfare involvement. And as part of that collaboration, the New York team, which included OCFS, but also our state partners, so the Office of Temporary Disability Assistance, the Department of Labor, and also the Division of Financial Services, because we all collectively wanted to develop not only anti-poverty strategies for families to increase their economic mobility, but more importantly, figure out what wealth building strategies we can employ to not only help families, right, who are experiencing poverty get out of poverty, but also to put them on a path to gain and build wealth, with the hopes that in New York State we can reduce the racial wealth gap, since we know in our child welfare system continues to disproportionately impact low-income families of color. And so we're still at the tail end of that project. We're currently working with a nonprofit who will assist us in the implementation of this innovative proposal by gathering evidence-based wealth strategies, wealth building strategies, in the hopes that we can produce somewhat of a blueprint for New York State. Hopefully we'll have that done by the end of this year. So two things we're doing right there. But again, if we can figure out some more flexible funding streams, trust me, we'll fund more primary prevention, because that's we know we need to get more upstream.
Yeah, absolutely. Thank you so much. And I'm from Wayne County, New York, which is right next to Monroe County. So I know the need and the wealth gap in that area. And so I'm really excited to know on the local level, knowing that community, what that impact is going to be. So one small step, but one huge step forward. Yeah.
Right.
Thank you so much for sharing. That is so exciting. Now, Capriya, I wanted to ask you about what other initiatives and strategies are you seeing on the ground as states operationalize this work and expand access to economic and concrete supports?
Yeah. So within our economic and concrete supports community of practice, we really provide space for that peer-to-peer sharing, where state and county human services leaders can come together and learn about how states and counties are operationalizing this cross-sector delivery of economic and concrete supports. And so within that community of practice, we've heard from state and counties about different strategies and initiatives, such as, implementing training that focuses on that mental model shift, the merging of various departments and agencies to have more shared data across their different departments, the use of family resource centers, and specifically collaborating with them as a partner and using data to identify kind of the needs of the families in their communities, and other strategies. And so we definitely have seen a lot of state and counties who have, benefited from being able to engage in this more on the ground practical discussion of how does this work look on the ground? Because as we know, states and counties look very different, across the country. And so really taking the time to dive deep into, those different strategies has been really beneficial for our state and county partners.
Thanks, Capriya. That community of practice has been great. And you've done a great job leading that, and the opportunity to peer share and really explore both the innovative solutions and barriers that states are advancing this work has been invaluable. So we just had our March meeting on Tuesday, and I'm excited to continue that work. Now, to bring us up to an event we're really excited about happening in just 3 weeks, Matt, I want to invite you to talk a little bit about how we are building a national strategy around economic and concrete supports.
Yeah, thanks, Meg. Well, I think I'd start by just saying, like, I think like the collective we like are actively in a national strategy right now that is really like changing the narrative around the fact that child welfare prevention is not the sole responsibility of the child welfare system. And I've been really humbled of just seeing the pace of change of how public benefit agencies, community partners, and kind of the humility of listening to people's lived experience to start to change kind of both how we think about this work and then how we operationalize it in a collective way. Um, I think it is contributing to a kind of grassroots level impact strategy to kind of change the design of our systems. I think the challenge that we have is that when we talk about shifting upstream of child welfare, like the term upstream is apt to me because like we are literally seeing communities and states and localities like that's an army of salmon that are swimming against the current, trying to kind of change the status quo while being pulled back from like the inertia of the current and trying to make those changes. And so as we think about kind of where do we go next, I think it's really like how do we change that current, like so that we are truly building a system that is designed around being upstream and supporting families where they are with their needs in lieu of deepening child welfare involvement. And so to that point, like we are super excited about an event that we're organizing in collaboration with Chapin Hall and other partners in April, where we'll be bringing together people with lived experience in the child welfare system who their poverty-based experiences or have been contributing factors to their involvement, bringing national partners together that are dedicated every day to this topic and this work as in the mission, as well as state and county agency teams that are actively collaborating in a cross-sector way to change the way that they deliver services for families that are at risk or currently involved in the child welfare system, and really kind of deepening our shared vision for what the future should be, and bringing that vision to federal policymakers on the Hill as well as in the administration so that we can really start to pull on the policy levers that are at the root of like why like we are swimming against the current right now and many of the strategies that folks like Suzanne and others are trying to advance.
Very excited for the convening. And it's only 3 short weeks away, which is very exciting. And we're can't wait to take that convening and carry on with the work. So with that, I want to turn it over to Yasmin.
Thanks, Meg. Now we'd like to open it up to questions from the audience. Feel free to put any more questions you have in the Q&A function. I've seen a lot of really great and hard questions, which I'm happy to pass along to my esteemed panelists. So I'm going to ask our communications team to help elevate some of the questions that came up, and we'll just try to answer as many as we can in the remaining minutes.
Great, thanks, Yasmin. I'll pull up those questions for us, but before we do that, I just wanted to share the results of that second poll that accidentally didn't get shared on the screen, about what you all think the biggest challenge is to providing economic and concrete support, so you can see what those results were. So you should all be able to see what you answered now. Thanks for taking the time to do that.
Looks like the lack of dedicated funding was the top choice at 31%, and siloed government at 23%, and eligibility and time limit restrictions for public benefits. This is really interesting. Thanks everyone for completing that survey.
Great, thanks for walking through those answers a little bit, Yasmin. So to start, we have a technical question, and I think this would be a good one for you, Yasmin, but anyone can feel free to answer, obviously. It is, can you expand more on the recommendation to provide direct funding? Do respondents have thoughts on whether it would come through IVB or whether they want it through IVE or CAPTA or something else? And does the flexible funding mean they want an increased allowable TANF transfer?
That's a really interesting question. And Leanne, I don't think we asked more specifically about that in the survey, if I recall, about a preference for which funding they would want to see expanded or used.
That's right, Yasmin. We asked about different kinds of funding that they do use, but we did not ask, okay, what's the preference? Although, if you recall back to one of the things we asked about what's around solutions, respondents did say direct funds, more direct funds, and then they expanded on that in some of the narrative responses that they wrote in, what some of those suggestions might look like for direct funds.
And for what it's worth, Yasmin, I would add too, we did ask about what are child welfare agencies' perspectives on who should be responding with those services. And I think what we saw was some nuance. I think certainly child welfare agency leaders felt that the child welfare system has a responsibility, but we also saw a strong interest in seeing the kind of family serving public benefit systems to be kind of at the forefront in delivering services and supports. And I think as we think about some of the challenges of how do you do this work without expanding child welfare in a way that has unintended impacts, there is an absolutely delicate balance that leaders of public systems have to think about in terms of how do you empower trusted community partners where folks are comfortable and where they go to access services and supports, that we are building capacity to be that front door of support and not the front door of a CPS system. And so kind of the funding streams that are leveraged in our strategies impact kind of what those models are. And so I think there's an active conversation of how do you blend things like 4E and building out a kind of expanded family first funding stream, but at the same time looking at non-child welfare funding streams that are an important part of the solution too.
And I'll just elevate that. We know that TANF cash assistance has gone down over time and is not provided to families to the extent that they might need it. So there's a lot of opportunities to use TANF funds differently and also to think about unobligated TANF funds. And we also see a lot of really innovative work going on through CB-CAP funds. So perhaps there are opportunities to expand some of those funding streams as well.
Great. Our next question is, does having a children's bureau or coordinating agency focus on collaboration between family serving agencies help overcome the barriers to interagency collaboration?
That's a really interesting question. I might actually ask Suzanne if she has any initial thoughts on that.
Well, I know that the folks at the Children's Bureau are 100% aligned with all the concepts we are relaying on this webinar. So they're clear that there needs to be more preventive funding way upstream. I think, right, I don't want to speak for them, but aren't we all limited by federal funding and Congress? I don't know what the specific organizational structures, the plans are, but I do know that they've heard the states when we say we would love for you guys to work with your federal partners, that provide separate funding streams to say child serving systems and then family self-sufficiency serving systems. We'd like for you guys to talk amongst yourselves in the federal government, and then that consolidated message will just hit us a lot differently, and they're doing that. So they're also working on cross collaborative efforts at the federal level and bringing all of the partners of a state or region together to talk about these cross systems initiatives. I don't think it's an official unit, but they're absolutely working together. HHS and all the divisions under them and with their partners and USDA and those other federal entities that have funding streams that impact our children's serving systems.
Yeah, Yasmin, I would just add too, I'm excited about the potential of I think late last year, early this year, after Congress authorized, as the HHS Assistant Secretary of Planning and Evaluation set up a federal children's interagency coordinating council that's starting to pull together at the federal level, kind of those constituent groups that could really look at a approach to child welfare prevention. And so I'm excited to see where that might go. And at the same time, looking at kind of state and local levels, health children's cabinets and those kind of organizing mechanisms can be a way to help bring kind of the de-siloing that's necessary across systems.
Awesome. Thanks, everybody. That's all the time we have for questions. Thank you, everyone, for putting your thoughtful questions in the chat.
Yeah, I really appreciate it. I think it's clear from our conversations today and all of the great questions and comments that we received that there's a lot of momentum right now to expand access, economic and concrete supports to families to prevent child welfare involvement. And I think it's a real opportunity for us to think about how we can do things differently and how we can better and more holistically support all children and families. So thank you everyone for joining us today. I just want to note again that you'll receive a follow-up email with a recording